Hello students, today we will discuss a swelling, very quite interesting because of certain special features, and you know that swelling is very commonly kept short case in the exam. Obviously it has got some management policies. So just see this, what this condition is. See that here eyebrow is there, lateral aspect of the eyebrow, there is a swelling. See that here. What is this swelling is? Look at that, very clearly it is seen on lateral angle of the eyebrow. You can see that eyebrow is overlapping over that swelling. So very typical, it is spotted actually. Oxy also they will keep. Short note will be asked, external angular dermoid. You might have seen many patients like this in OP. So it is external or lateral angular dermoid, right side of course, the type of sequestration dermoid. All of you know, sequestration dermoid is a very common. All of you know, sequestration dermoid is a very common dermoid. Next is tubulodermoid, like example, thyroglossal cyst, then implantation dermoid, then teratomatous dermoid, like ovarian tumor, teratoma, like that. Implantation dermoid usually is post-traumatic, especially nail tip, finger, not nail tip, fingertip, then toes, where small injury occurs, thorn prick or anything, eventually forms a swelling. So sequestration dermoid is a very common entity where it occurs in the line of fusion, maybe midline, maybe in the skull. There are so many lines of fusions are there. So it can occur any of these lines of fusions where fusion won't occur layer by layer. So epidermis or skin component get buried underneath and goes deep sometimes and forms a sequestration and swelling which contains material, which contains cells like squamous cells and not clear fluid. So and sometimes get eroded into the bone, sometimes it enters into the cavity there. If it is in the skull, may go into the meninges or brain, intracranial extension also there. So there is swelling outside, inside also. So different types are there. Commonly outside it is, often erodes into the skull, outer and inner tables, sometimes only outer table, sometimes get buried into deeper plane. Occasionally only inside it is there, outside it is not visible, very rare it is, but it can happen. So that is what is called as where line of fusion, that's a point important, embryological line of fusion, it happens, that is sequestration dermoid. So different places, different line of fusions are there. So you have to remember for a particular dermoid cyst, what is the line of fusion. So for lateral angle of dermoid or external angle of dermoid, this swelling, whatever you see here, that is at the frontozygomatic suture line. So that's usually a MCQ question. Especially the preauricular, postauricular, lateral angular dermoid, midline dermoids. So what suture line it happens, so you should know that. You can always read my SRB's manual of surgery where detail which suture line each dermoids can occur. It is very clearly mentioned. So please go through that, my SRB's manual of surgery swelling chapter. It will give the very detailed thing about the sequestration dermoid, which is a short note also. So restricted mobility. That is very, very important. With the bone erosion, slip sign, there's a flipping, erosion sign, not slip sign. Slip sign is a feature of lipoma. Put the finger over the edge, you can feel the erosion. See that? This is the one. This is the one. Slip sign, it's erosion, not slip sign, erosion. Slip sign is the lipoma, but method is same. But here you will see the bone erosion. So pushing the margin, eliciting by pushing the margin, that's our edge. So you can feel the erosion. This is very important test actually to find out bone erosion is there or not. If it is so, it should be identified, assessed by proper CT scan of the area, especially in the head area. And if it is eroding into that, you do it under GA, exercise under general anesthesia. Often you may have to take neurosurgeon's help or ophthalmologist help, especially area like this, it may erode into the orbit. So we need to take the help of the ophthalmologist or neurosurgeon. So there is a point which is important. Now remember the differential diagnosis. Lipoma it will be similar, where you can have slip sign, soft, erosion is not common. Skin is free, of course, in both. Dermoid skin is free, lipoma skin is free. So lipoma usually don't go into the deeper plane. So excision under local anesthesia is sufficient. It's simple excision after making incision. Whereas here it is quite deep, it is, so requires general anesthesia. Another differential like sebaceous cyst, it is a subcutaneous swelling arising from the skin. Sebaceous gland get blocked and cyst get enlarged, often called as epidermal cyst. That controversy I'm not going to discuss here. Colloquially, it is actually, traditionally it is considered sebaceous cyst and well accepted terminology, even though there are different pathological events. So whereas punctum may be there on the summit, and swelling is adherent to the skin. Skin is not free in a sebaceous cyst. You can't pinch the skin. So that is the point of differentiation, and sebaceous cyst will not erode into the deeper part. So excision under local anesthesia is sufficient unless very large sebaceous cyst patient may not able to tolerate the injecting the local anesthesia. We have to do the give general anesthesia. Otherwise, local anesthesia is sufficient. Whereas here is totally different. Skin is free. It is rather deep. Bone erosion is common. We need to give general anesthesia. You need to take sometimes neurosurgeon said. That is the point which sebaceous cyst, dermoid cyst, lipoma, and neurofibroma is another. It is firm, moves along the line of moves perpendicular to the line of the nerve pathway. So that is neurofibroma. Skin is again free. So these are the 4 differential swellings which you have to remember as a differential diagnosis: dermoid cyst, sebaceous cyst, lipoma, neurofibroma. So I already told frontozygomatic suture, where external angular dermoid occurs, orbit may get involved. Sebaceous cyst here in this special location, lacrimal gland swelling may be also a differential diagnosis. CEC head is a must. So treatment is excision and general anesthesia. Neurosurgeon and ophthalmologist help may be needed. So that is the point. So I can always read my book or reference is there for external angular dermoid, my manual and my clinical methods book also. It is given in detail about the clinical feature, different photos are there. Students, answer the MCQ. I will acknowledge your answer, appreciate your answer. I will give the right answer later. So hillocks of his are relevant in relation to a dermoid ear, preauricular dermoid, postauricular dermoid, lateral angular dermoid. Please put it in the comment box. What is the right answer? Preauricular dermoid is formed at squamomustard suture line, B. squamotympanic suture line, C. frontozygomatic suture line, frontoethmoidal suture line. Put the right answer. I will acknowledge your answer. And quotation of the day: loyalty is a responsibility, not a choice. Remember, if you are working somewhere, you should be very, very loyal to that particular system, maybe institution, maybe working group or working category, whatever it is. Otherwise, you should, if you are not loyal, should not go through with that system. That's very, very essential to progress yourself and to the system as such. That is the exact meaning. That is the quotation of the day. Students, please go through my SRB's manual of surgery, SRB's clinical methods in surgery, and SRB's operative surgery, surgical atlas. The new edition has come, and atlas of such steering technique. Manual gives everything in detail about all topics as per CBM syllabus: general surgery, gastrosurgery, urology, neurosurgery, cardiothoracic, and basic instruments, specimens, brief operative surgery, which is essential for UGs. Everything is covered with the quotations, with the illustrations, the diagrams, photos, covered everything as per CBM syllabus. And clinical methods in surgery, current edition gives a proper clinical idea, approaches to all cases, briefly orthopedic also. Again, it contains instruments, specimen, images also, and videos. Each chapter videos are there how to examine a patient, which is very important when you do a practical exam, clinical exam. So very, very useful, everything, with again lot of photos and proper methodology of examination with the differential diagnosis tables are given. So it will be very, very useful. Of course, operative surgery is a very detailed 2-volume extensive book with more than 10,000 photos and illustrations. Whenever you want to any surgery, including specialty, general surgeries, gastrosurgery mainly, in detail it is given. It will be very, very useful. So students, also go through my SRB's Surgery Insight YouTube insights, and please subscribe for all these lectures, daily lectures for brief 6 to 10 minutes, and live sessions once a week or once in 2 weeks I am doing. They're also very, very useful for students with with the interaction with the senior faculties are there, and always they can answer your doubts and through chat. So please subscribe my channel, YouTube, Instagram to have a better knowledge and increase your surgical knowledge as such, because it is free also. And my DigiNow lectures through JP, around 220 lectures covering everything surgery, including specialty, operative surgery, clinical methods also with the videos through JP Publishers. And you can always purchase that one for 1 year so that you can have go through all lectures so that a very clear idea about the subject to face any exam, including NEET or final year exam or even PG exams. So students, I hope you have understood this lecture, external angular dermoid, very well. Thank you so much.